Dengue is a viral infection transmitted to humans through the bite of infected mosquitoes. It is found in tropical and subtropical climates, and about half of the world's population is now at risk. The infection is detected by testing for diagnostic markers such as NS1 antigen or IgM/IgG antibodies. NS1 is present in the blood from the early clinical phase, whereas IgM and IgG are produced by the immune system in the convalescent stage. To prevent severe illness, early diagnosis and treatment are crucial, and NS1 is the most suitable marker. However, rapid diagnostic tests in general have low sensitivity. At Fujifilm, we have addressed this issue by developing a highly sensitive, rapid diagnostic test detecting NS1. Fujifilm SILVAMP Dengue NS1 AG is an advanced test kit based on our silver amplification technology, which originated from the photographic field. It amplifies the size of the gold colloid particles by about 100 times. In just 3 steps, you can detect a small amount of NS1 in human serum, plasma, and whole blood. Step 1. Add the specimen into the reagent tube and mix the contents several times. Step 2. Apply 1 drop of sample solution to the cartridge and press button 2. Wait approximately 15 minutes until the Go Next mark turns orange. Step 3. Press button 3 to start silver amplification. The result can be read in approximately 1 minute. The test can also be performed using the optional Fujifilm SILVAMP reader. Its walk-away mode ensures reliable and efficient testing. Fujifilm has made early diagnosis of dengue a reality by introducing this highly sensitive Dengue NS1 antigen test kit.